Today we are going over how to myofascial release trigger points of the muscles in the upper back and shoulder girdle using a soft ball. Place the soft ball on the wall and press your upper back against it. Rotate the ball around your upper back muscles and shoulder girdle area. When you find sore or tight areas, hold that spot and apply pressure for 30 to 60 seconds or until the area is released. Myofascial tissues are tough membranes that connect, wrap, and support your muscles. So the soft ball is used to dig into the muscle fascia and release the tightness. Tightness in the body can occur from sore muscles, either from exercise or day-to-day activities, sitting too much, emotional trauma, stress, or the gravitational pull of planet Earth. Releasing your muscles can be painful, but it's a good type of pain. When you release the muscle fascia, it will feel like you're taking a breath of fresh air as oxygen and blood enters that area. You may even fall asleep because your oxygen and blood circulation is increasing, making you feel more relaxed. So once you release a few areas in your upper back and shoulder girdle, stretch the muscles out. Stretching will increase your flexibility, range of motion, and reduce tight muscles. The muscles that are targeted for this myofascial release are some of the shoulder girdle muscles that move the collarbone or clavicle. This technique is primarily releasing muscles of the levator scapulae, rhomboids, and trapezius. The levator scapulae is located in the back posterior and lateral side of the neck. It extends from the scapula up to the bottom of the skull. It functions in shrugging the shoulders, lateral flexion of the cervical spine, side bending the neck, and extension of the cervical spine. The nerves that supply this muscle are the cervical nerve and the dorsal scapular nerve. The rhomboids are located directly near the medial border of the scapula, in the posterior upper back region. The rhomboid major is larger and positioned below the rhomboid minor. The softball will release both of these muscles. It functions in pulling, bringing the shoulder blades together. An example of using the rhomboid muscles is pulling a drawer open. You can strengthen these muscles by doing chin-ups, dips, or lateral rows using resistance bands. The trapezius muscle or traps is a large muscle consisting of 4 parts covering the upper back, shoulders, neck, and extends to a V in your lower back. The traps function in overhead movements and used in shrugging the shoulders. They also help you move your body and have great posture. The trapezius muscle is the most superficial muscle on the posterior aspect of the neck and thorax, meaning it's closest to the skin. The underlying layer is composed of the levator scapulae, the major and minor rhomboid muscles, and the latissimus dorsi. The latissimus dorsi or lats are the largest muscle in the upper part of your body. It starts below your shoulder blades and extends to your spine and the lower part of your back. If you rotate the softball a little bit lower on your back, you will release this muscle too. The lats help you extend and rotate your shoulders and arms. An example of using the latissimus dorsi muscles is during climbing. The lats also assist with breathing, enhancing the movement of the trunk during inhalation and exhalation. When you do this release, you may feel tension relieve in the front anterior part of your body, in the upper chest region, because the serratus anterior and the pectoralis minor are part of the shoulder girdle muscles. The reason you feel more oxygen flowing through your body is because some of these muscles surround the rib cage and respiratory area that helps you breathe, the latissimus dorsi being an example. Continue to do this myofascial release technique and you'll notice the benefits.